You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veach. I'm your host, and on this program we'll be discussing topics of interest for caregivers of loved ones with dementia. We hope that you will subscribe to the channel and you'll hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new program. And now, this is Once Again. My guest today is Zane Rutledge. He is the music therapy supervisor at Vibes in Casper. We're going to be talking about the role of music therapy in dementia care. And Zane, thanks so much for being with us today. Let's start at the very beginning. What is Vibes?
Yeah, thanks for having me. I appreciate getting to spew my guts a little bit and advocate for what I do. So Vibes is in Casper, and we are a private music studio and music therapy provider. So we provide a lot of private music lessons and classes, everything from individual piano and guitar and voice lessons to classes, drum lines, and even we do a program called Kinder Music that is a developmental program for individuals aged like 0 to 5 or 6, where everything we do is research-based and is meant to help with their development. And then on the other side of our business, we have music therapy, which we implemented as part of our business model about 5 years ago when I came on. And there we provide private practice music therapy, home health music therapy, and then we actually contract with a lot of the town to group music therapy as well.
What's your personal background? Vocal, instrumental, what?
Yeah, so I actually didn't do anything other than choir until I went to college. I was originally going to go to college for nursing, and I like to say I got tricked into being a music therapy major because they offered me a really substantial scholarship, which turned out to be a little different by the time I received that reward letter. But my primary instrument in college was voice, and then as part of your degree program, you're required to learn guitar and piano as well.
As I mentioned a moment ago, the topic today is the role of music therapy in dementia care. When we think about dementia care, we think about a lot of different
Mm.
aspects of it, but I don't know if the role of music therapy is necessarily at the top of the list. What can be done? What is that role?
Yeah, so honestly, I get that a lot. There's only, I think, 8 or 9 credentialed music therapists in the state of Wyoming, so we're pretty few and far between. I actually think the biggest thing that we impact is, yes, there's all of the feel good portions of music therapy that we love to highlight and the quality of life aspects. But I think actually one of the biggest research driven things that we do for our patients is actually improve their cognition. Music therapy is actually one of the only approaches or interventions that we have, whether pharmacological or not, that is shown to improve cognition throughout the progression of dementia. There's actually even a study, I believe it was done over 8 weeks, where your experiment in your control group actually saw somewhere in the single digits. I want to say it was around 5 to 8% of a decline in cognition just over that 8 week period, whereas the music therapy group experienced around a 112% increase. So even then, the effect size is not small. It's huge for these individuals.
You talked about improving cognition. What does that include?
So a little bit of everything, really. You can actually tell in session from start to finish the change in an individual as we get going. You'll see that a lot of their lethargy kind of diminishes. That even individuals that have progressed to a point where they're almost nonverbal, you start playing Blue Suede Shoes, and they're up and they're dancing and they're singing along, and it takes them still some time, but they're telling you even a story about a time where they were dancing with their husband or their wife. And I think the biggest thing is kind of highlighted by their storytelling that, they'll understandably have a lot of difficulty answering even sometimes simple questions about their life and their experiences. But, once you get a couple songs in them that are familiar to them, they're just telling you on their own. They're telling you about a time they were at a dance hall with their husband and how they looked across the room and that's how they met and they fell in love and then they had 7 kids and they lived on a farm. And it's really quite magical. I have a patient currently that I see quite regularly that they always come to the group sessions and they're distraught and they're filled with anxiety and they're really perseverating on, their upcoming doctor's appointment. And then you play a couple songs that are familiar to them. They sing all the way through. And then now, rather than that perseveration, they're telling us stories about how they were a really prolific skier when they were in high school and college, and how they, worked all these different jobs and they knew all these people and all the different meaningful things that are important to them.
Is the music a one size fits all, or can you get some background on the individual and tailor the music to that person?
Great question. So I would say in Wyoming, it's a little bit of a one size fits all just because of the demographic.
Yeah.
But largely it's almost entirely based on what the music preference of that individual is. I kind of describe it almost like a key and a lock situation where, if you're forceful enough, you can probably pick the lock, but you're going to have a much easier time getting those memories unlocked if you're using something that's specific to the lock. And so when we pick music, we're looking for mostly two things. One, is it relevant and preferred by the patient? So, if I've got a patient that really loves John Denver and Johnny Cash, I'm not going to bring in some Metallica. That would be probably a little off-putting and not very reminiscence centered. And the second thing is actually the age range of the music. Specifically speaking about, we want to almost always pick music from that was popular and relevant to them in their late teens and early 20s. That appears to be the most cognitively evocative music that we can use. And a lot of that, I believe, has to do with the fact that that's kind of when you're really cementing parts of your personality and who you are, and you're kind of solidifying yourself as an individual versus, part of the family unit.
So if it's Frank Sinatra or Tom Jones or Neil Diamond, you got them covered. Is that right?
I'm I'm usually pretty safe with those three. That's right.
Let's talk about what happens in one of the sessions, and we're actually going to show you some examples here in just a moment. But what what takes place in one of your sessions? Kind of break it down a little bit, I guess.
Yeah, so it's a little different if we're doing an individual session or a group session. If I'm doing an individual session, honestly, most of the time it's kind of just this on loop process of, I'm going to kind of prime a question that I want them to think about and answer. And usually it's very storytelling based, right? We don't ask a lot of, give me this specific detail, because a lot of times that's still not a task that they're going to be very successful at. And then they're going to get really frustrated, and then the session's going to tank and not be very effective or helpful.
Don't want that, yeah.
Right, right. So instead, I might ask, tell me about a time that you overcame something that was difficult. Because then once the music gets going, that music is going to help prompt them. We talk a lot about how the music is almost our co-therapist. And then by the time we get to the end of that music, that story is kind of primed and ready. So we're going to have them tell the story. I'm going to ask some, questions to help them expand and give more detail, and reach farther back into the filing cabinet. And then we're going to kind of rinse and repeat. We're going to go back to the music, and they've got an instrument the whole time. If we can get them to do a little dancing, even better. But in those individual sessions, a lot more of the focus is on the interaction between them and the caregiver and that reminiscence. In a group session, though, yeah, I structure mine pretty rigidly. We do reminiscence and singing, we do dancing, and then we do instruments and singing.
Let's take a look now. We'll give you an idea of what we mean in the reminiscence part of that. This is a clip that was shot recently here in Casper. We'll give you an idea of what Zane Rutledge of Vibes in Casper, how that goes. Here's that clip.
I know you guys have told me a little bit about that in the past. And I think you helped set up some of the routes on the mountain, is that right? Which routes were those that you helped set up, Monty? Mm-hmm. Okay. And I think Holiday, right? Woo. Sounds like a lot of work.
You talked about dancing as part of it, and I would imagine that could be a little tricky because some of the folks that you work with maybe wheelchair bound. How do you get around that? How do you work that out?
Yeah, so a lot of those individuals, we really rely a lot on our support staff as well. You might even be able to tell in some of those clips that there's a lot of support staff walking around in the background, and they're kind of got their eagle eyes scoping at all times. So,
Yeah.
oftentimes we're getting a little bit of assistance from respite providers or CNAs or nurses, but our biggest kind of approach is about inclusion. We want to not make the process anything where there's barriers to entry or more frustrating, because most of the time those patients and residents are dealing with enough frustration on their own. And so we use a lot of scarves. We do a lot of scarf dancing, a lot of chair dancing, where we're still able to at least encourage a lot of movement and activity in their lower extremities, while maybe just focusing more on those upper extremities. It's kind of one of those things where, we aren't physical therapists. Our goal isn't to try to rehabilitate you back to walking. Our goal is to just really do some motor maintenance. We're trying to make sure that we don't lose further function from anything that's currently there. So we're doing a lot to maintain it rather than necessarily build it back.
And let's talk about that dancing section. We've got another clip for you here of a session that Zane Rutledge recently conducted at a group here in Casper. We'll take a look at that now. We are coming to the end of our time here. This is actually going to be a two-part interview, as we're wrapping up part one here with Zane Rutledge, a music therapy supervisor at Vibes here in Casper. If someone is interested in, someone has a loved one they're caring for who's interested and thinks that their loved one may benefit from this kind of service, you do this privately as well. Is that right?
Yeah. So
And
we
how would they
actually
get in touch with you?
Yeah, great. So they can do a couple of different things. If you have a loved one that has dementia, I'd usually recommend that first you actually reach out to Wyoming Dementia Care. We actually have a grant that is funded by Wyoming Dementia Care, where as long as an individual is referred through them and then sent our way, we can provide them 5 hours of in-home health treatment totally free, with the next 10 hours after that at half coverage. And so for a lot of these families, that are also on fixed income, where they don't have a lot of flexibility in their spending for something that, especially when they don't know what it is and they're really taking a chance on something, that's a great way to lower their barrier to entry, and is something that I'm always very excited about, is making it to where there aren't those barriers to entry. And so once you get in touch with Wyoming Dementia Care, Danny over there will usually send that to us. So, you're welcome to reach out to us first, and I'll happily talk your ear off and give you all the information you could ever want. But ultimately, I'm going to send you back to Danny anyway, so that you can hopefully get some services covered by them.
That information, we will have all of that in the description box below. This is going to wrap up part one of our part two of our two-part interview with Zane Rutledge. He is music therapy supervisor at Vibes in Casper. We've been talking about the role of music therapy in dementia care, and we will be back with part two on our next edition of Once Again. You've been watching Once Again, a YouTube video presentation of the University of Wyoming Center on Aging. We hope, if you haven't done so already, that you'll subscribe to the channel and hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new video. Thanks so much for being with us. I'm Scott Veach. We'll see you again next time.